that there's likely a, I guess you'd call it like an additive or sort of a cumulative effect, right? So we know that brain tumor may have a, um, depending on the location, will have a specific kind of, what's the word I'm looking for? A profile or a sort of pattern of deficits associated with it, um, as do those other neurodegenerative conditions that we'd be concerned about. So Alzheimer's has a kind of a characteristic pattern on testing. Frontotemporal dementia and the progressive aphasias, they have characteristic patterns on testing. So obviously, when you have multiple conditions or multiple factors that are potentially at play or under consideration, then that can make that a much more challenging task to kind of distinguish what's this and what's that. Um, but ultimately, if just kind of spitballing here, but if somebody did come in with, this was a someone who had a brain tumor or has had a brain tumor, been treated for a brain tumor in the past, and also are having cognitive declines that might raise a suspicion for Alzheimer's, kind of getting older, that sort of thing, then my job would be to say, well, what can I account for? What kinds of cognitive problems can I look at and say, okay, this is definitely because of the brain tumor, or this is definitely because of the uh, radiation treatment. And what are the cognitive issues that I cannot account for, and say, what does this pattern look like?
Okay.
Yeah, that's a really good question. That's oftentimes that's the kind of why folks might end up with a neuropsychologist too, to help tease those things apart.